Hello and welcome to episode 13 of Know Your Doctor. We have with us today Dr. Puneet Bhuwania, Senior Consultant Nephrologist at Wockhardt Hospital in Mira Road in Mumbai. Dr. Bhuwania completed his MBBS from RGUHS University in Karnataka, followed by an MD in Medicine from Pune, and went on to earn his DNB in Nephrology from Coimbatore. With a special interest in kidney transplantation, he has successfully completed over 50 transplants in just the last 4 years at Wockhardt Hospital. His dedication and excellence in the field have earned him recognition as the Young Nephrologist in Mumbai in 2023 and Trusted Nephrologist in Mumbai in 2025. We are delighted to have him with us today. Welcome to the show, Dr. Puneet.
Thank you, sir. Thanks for having me.
Awesome. So, Dr. Puneet, I think we'll just get started right at the beginning. All of us, when we are in our school, high school, and it's time to decide for which field we are going to take, whether it is medicine or engineering or commerce or arts and so on. It's a big dilemma for many of us. So, what drew you to medicine? Is there a history of medicine in the family or something totally new? What was the spark?
So actually, to be very frank with you, there's no doctors in our family, and it actually started with a dream of my grandfather.
Okay.
So his dream was someone should become a doctor in the family. He could
Okay.
not because of some circumstances. Then my dad could not. And at the end, we are all Marwadi, so we were thinking of doing business. But then in my 11th standard, he said that I need you to become a doctor. And then, as I'm very close to my grandfather, once he told me this, so there was no looking back. And
Nice.
then subsequently, everything happened by itself.
So you're the first doctor in your family.
Yes, sir.
Wow, that's
Yes.
amazing. That's amazing. And then you got into medicine, and then I guess it was time to choose your specialty. And then nephrology it's quite a daunting specialty. A lot of people say that nephrology is very, very complex and so on. So why nephrology among all the various specialties that are there?
So, sir, that's also a funny story. It's actually began in my MBBS. So, whenever someone joins MBBS, they have that dream that we need to become a cardiac surgeon. That's the general thought process which everyone has.
Right.
Then, when I went into an internship, then I realized that surgery is not my thing. Then I
Okay.
thought, okay, medicine is the thing which I need to go ahead with. And then in medicine, when then subsequently I went for my counseling for my super specialty, it was either cardiology or it was either nephrology.
Okay.
So some luck, what happened was one of my friends were there, and I was, I think, the last two, three people, and there were two, three seats remaining for nephrology. And then I was looking to do cardiology in Mumbai. But then certain institutes I wanted which I could not get. So
Okay.
I thought, I think rather not waste my time, I chose nephrology. So it's just like I ended up, or nephrology chose me. I did not choose nephrology. It's just that
Okay.
I ended up in nephro.
Okay. So I guess cardiology's loss is nephrology's gain.
So actually, I would say it's my gain that I nephrology chose me.
Yeah,
So
of
at the
course.
end, I feel that was the correct decision. Whatever happened was the right decision.
Absolutely. Absolutely. Now, within nephrology, is there a specific part of nephrology like AKI or transplant or HD or, the bunch of things that we have in nephrology? Is there some particular part of it that excites you the most?
So it's always been kidney transplant. It's always
Wonderful.
since the day I joined and the day I saw two, three patients just recover completely. But I saw an 360-degree change in a patient from on a dialysis and then after a transplant. That gave me a motivation. No, transplant is the thing forward, and then that's what I need to go after in my future.
Wonderful, wonderful. I totally agree. And I think at NephroPlus also, we are very excited about transplants and we strongly
Yes,
encourage,
sir.
we do education. We have a event called Asha, which I'm sure you're aware, and where we have a
Yes, sir.
nephrologist talk
Yes, sir.
about the benefits of a kidney transplant. While we do hemodialysis and peritoneal dialysis, I think we are very, very convinced that transplant, there's no match for a kidney transplant, in terms of the quality of life for a dialysis patient. So really good to know that transplants excite you, Dr. Puneet. Is there some incident that comes to mind or some particular patient in your journey which you can't forget, which was very, very striking, which was very, something that is unforgettable in your memory?
Yes, sir. So this is not related to transplant, sir. This is actually a case of glomerulonephritis. So how the case came to me was this was a young boy around 16 years old. He was having fever since the past 3 or 4 months. got evaluated multiple places, then started developing swelling. So with swelling, he landed up to me. And then from the swelling, I went back to his evaluation again. Then I found him to have nephrotic syndrome. So when you have nephrotic syndrome, generally you start immunosuppressions, you give the other medications needed. But then when I deep dived into it, I found he had a lymph node in his neck. So then lymph node underwent a biopsy and found to have tuberculosis. And
Oh,
then once the tuberculosis got treated, his nephrotic syndrome completely resolved. So why I
oh,
remember this case is when he was found to have this TB, lymphadenitis, and nephrotic syndrome, his weight was around 40 kgs. He was very sick. And this is I think 2 years back. He's doing regular activities, he's joined work. So the drastic gain in his weight from 40 to 80 kgs, and that photograph, once I share it to you, you'll never forget it. I have the photograph. That photograph drives me every time to see change in a patient.
wonderful. That's wonderful to know, doctor. Great. Uh, Now, coming to your personal side, doctor, we discussed a little bit about your professional life. We would like to know a little bit about your personal life. So, who is there in your family, doctor?
So I live in a joint family. I live with my parents. I have a younger brother who's in US. I have a wife who's a pediatric anesthetist, and I recently celebrated my girl's 1 year birthday. So
Oh,
I've got
wonderful.
girl child as well.
Wonderful, wonderful. And you have any hobbies that I'm sure the whole day is quite taxing and quite brutal. So, is there some hobby or something that you pursue either on weekends or when you get back home in the evening or something like that?
Yes, sir. So on Sundays, we've got a cricket session.
Oh,
So
nice.
we have a doctors cricket league. So on Sundays,
Wonderful.
somewhere some by 9 to 12 or on 1 to 4. So doctors have made their own cricket league. We have a proper cricket match with
Okay.
doctors of the other hospital. And that's once in a week where I can detox myself or just
Lovely.
relax. Yes.
Lovely. Lovely. And do you pursue any kind of like jogging or some fitness activity during the week, every day, like morning or
Y-
evening or something?
Yes. So initially, just 2, 3 months prior, I used to visit the gym 3 or 4 times a week. But then since the last 2, 3 months, because of this heavy load, I've not probably plan to restart it again in the next 1 or 2 months.
Okay. Okay. Nice. Nice. And are you fond of watching movies or reading books or something like that? Anything
No,
you
sir. I
want
think the
to
MBBS books were enough for me. I
recommend?
think no more books, maybe some articles here and there. But then, yes, movies intermittently. When our child goes off to sleep, we sneak in those 1 or 2 hours in the night.
Nice.
So
And
probably
I
after
guess
that.
you watch it at home. Do you ever get a chance to go to a cinema hall or something like that?
Not
Good.
not
Yeah.
much, sir, not much.
Yeah. 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 And you go off, you get a chance to go off on a holiday, doctor, at some point with family or friends or something like that, vacation.
Yes, sir. So we make sure that at least once a year we take a family trip for a week or so.
Nice.
And our duty or our job demands us to be around. So maybe just once a year, I try to take that 5 to 6 days of leave.
Lovely. And which was the last holiday that comes to your mind, which was really memorable?
So I went to, I think, Abu Dhabi with my wife during her pregnancy. Maybe I think she was 6 months into her uh,
Okay.
pregnancy. So maybe that's what I remember because we went to Yas Island. We enjoyed that time. So
Nice.
that's what I remember last.
Lovely. Lovely. And in your family, your culture, like which is the most important festival of the year, like something that you all look forward to?
Diwali, sir. It's
Diwali.
always been Diwali.
I
Yes.
guess. Yes, yes. So what do you do for Diwali typically?
So we have that Choti Diwali and Badi Diwali. So
Right.
and my brother also comes back during Diwali times. He takes
Okay.
those 3 weeks leave and then he comes, we celebrate, and then probably we have a family dinner with my in-laws, and then maybe 1 or 2 days here and there outside, just a small vacation, a small
Wonderful.
trip. That's what we do, sir.
Your brother, you said, where is he, doctor?
He's in US, sir. He's
Ah,
working for Microsoft. Yes.
lovely, lovely. Great, Dr. Puneet. I think that was a great introduction. Now we'll move on to a section we call the rapid fire,
Yes, sir.
where I'll ask questions quickly and you have to answer in 1 or 2 words very quickly. Okay?
Right, sir.
We
Yes,
get
sir.
started. One movie you would recommend to others.
I'm actually a movie fan in terms of history and wars. So I love the 300 movie, the
Okay,
English Hollywood 300.
nice. Your favorite actor?
Shah Rukh Khan,
Favorite actress?
Kajol.
Favorite food?
Uh, Actually, I love sweets. So any sweet is fine with me.
Pick one.
Kalakand,
Okay, nice. Tea or coffee?
coffee, sir.
How do you like it?
Cappuccino with the milk.
Nice. Beach or hill station? Your favorite holiday
Beach.
destination?
I get giddy while traveling to the hills, so I think I stick to beach.
Which beach last did you go to?
Last was Goa, sir, 2 years back. Just two
Nice,
years back. Yes.
nice. Your favorite specialty other than nephrology in medicine?
Cardiology.
Okay, and your least favorite specialty in medicine?
The whole medicine, if I take, I'll not love gynecology. I just don't
Okay,
like.
okay, cool. Okay, doctor, that you did very well, Dr. Puneet. Thank you so much, and a big round of applause
Thank
for
you,
the
sir.
rapid
Thank you.
fire.
Thank you.
I think we'll wrap up with a short message to your dialysis patients watching this episode. What would you like to say to them?
Just want to say, stick to your schedule, maintain your water compliance, and just take care of your access because that is the thing which is taking care of you.
Awesome, awesome. Wonderful, Dr. Puneet. It was such a pleasure having you today on this 13th episode of Know Your Doctor. Thank you so much for taking the time. Thank you.
Pleasure is mine, sir. Thank you.